Good afternoon. Thank you so much for joining us here. My name is Lee Carter. I'm the Democratic Party's nominee for the Virginia House of Delegates in the 50th District, which encompasses the city of Manassas and parts of western Prince William County. And today we have a gathering of candidates here who are all united behind a goal of fighting for single-payer health care in the Commonwealth of Virginia. We recognize that it's going to be a very long fight, but it's a fight that we are not going to stop until we've won. In addition to the candidates that we have present today, we have a full list of candidates that are pledged to this fight. They are Flo Kettner in District 7, Steve McBride in District 8, Stephanie Cook in District 9, Angela Lynn in District 25, Brent Finnegan in District 26, Joshua Cole in District 28, myself in District 50, Morgan Goodman in District 55, Kellen Squire in District 58, Jamal Johnston in District 60, Francis Stevens in District 65, Kimberly Ann Tucker in District 81, David Rose Carmack in District 83, Steve Aycock in District 88, and Corey Johnson in District 97. In addition, Michelle Edwards signed on after the press release was issued, so I should mention her. And what we've all signed on to is a basic pledge, which I will now read. The United States of America is among the richest countries the world has ever known. Despite this fact, millions of our citizens lack access to even basic medical care because of an inability to pay, making the rights to life, liberty, and the pursuit of happiness contingent upon their financial means. Healthcare policy has historically been driven by the federal government, which has failed time and again to protect the right of all Americans to have access to medical care. Our federal representatives are divided largely into three camps: those who wish to extend Medicare to all, those who want little change to healthcare policy, and those who would deregulate the health insurance industry. The consequences for Virginia residents of this federal decision are too great to be left to chance. We, the undersigned, understand that it is the responsibility of the General Assembly to protect the health and safety of all Virginians. As such, we pledge to fight for a single-payer healthcare system on the state level, which will protect all people who call Virginia home, regardless of what decision is made by the federal government. And on that note, I will turn it over to the rest of the candidates that are here today, starting with Mr. Joshua Cole.
Good afternoon, everybody. I'm glad to stand here to join with my fellow candidates who are running across this great Commonwealth as we fight for a look into and pushing for a single-payer healthcare system in the Commonwealth of Virginia. It's very, very key. As we've been discussing this the entire length, I even talked to my opponent previously, and I said, for a party who proclaims to be so pro-life, I'm not seeing this in this push for health care. This is not just a partisan issue, this is a human rights issue. And so as we push for health care, affordable health care throughout this Commonwealth, it's key that we understand the enemy is not each other, the enemy is the views of the people who are trying to hold us back. And that's the strongest point. We have people who are low-income families, and those are the working class families. This is an attack on them, and we have to make sure that we're fighting for everybody, fighting with each other to make sure that affordable health care is a viable option. So that's why we're pushing, that's why we're fighting, and it's definitely time that we have people who are in Richmond who are willing to fight for us and with us for this measure. Thank you very much.
Good afternoon. My name is David Rose Carmack. I'm running for House of Delegates in the 83rd District this year. Our healthcare system is fundamentally broken. Health insurance and pharmaceutical companies turn billion-dollar profits, and still they raise our premiums without fail every year. They hike prescription drug prices hundreds, even thousands of percent overnight. They create instability in our healthcare industry, withdrawing from our market, creating insurance monopolies and coverage vacuums in counties and cities across our Commonwealth and across this country. They deny people the care their doctors say they need based on their formula. They deny people access to life-changing medications and a decent quality of life. And in many cases, the prescription drugs that they need to survive? How long can we continue to live at the mercy of insurance companies and pharmaceutical companies? How long can we continue to allow these for-profit corporations to make their own rules? How long can we continue to allow profits to take precedent over human life and dignity in our healthcare system? How long can we treat healthcare like a commodity instead of a right? How long can we continue to pay more only to suffer more? I'm out here fighting for my neighbors who I grew up with. They worked for our public school system, they paid their taxes, they saved for retirement, they sent 2 daughters to college, they did everything right, and finally they retired, and their lives were derailed by a cancer diagnosis. And they spent everything they had on a treatment that didn't work. And now my friend is gonna spend the rest of his life wondering what's gonna happen after I'm gone, because there's nothing left. I'm out here fighting for my mom, who's overcome a disability, who survived cancer while raising 3 boys on her own, who has battled a chronic spine condition, a shoulder injury, rheumatoid arthritis. She has beaten every health challenge that has come her way, but she cannot overcome the endless medical bills that come with it. And it threatens her future after 46 years in service as a director of a nonprofit. These are the stories I hear in this campaign. These are the reasons that we fight. We're in a time of tremendous consequence, and we have a choice. We can choose the status quo. We can choose politics as usual. We can choose lawmakers who cater to for-profit corporations and special interest groups and laws that give them the power instead of the people, or we can stand up and choose to put human life ahead of profit. We can acknowledge the fact that healthcare is a human right. We can understand that if we come together and lift one another up, that we will all rise together. And I have no doubt that if we work together, we will see the change that we seek. Thank you.
Good afternoon, everyone. My name is Flo Kettner, and I am running for House of Delegates in District 7, which is down in Christiansburg, Floyd, and Pulaski. Healthcare hits home for me. I have many family members who have to deal with healthcare on a daily basis. I have friends and neighbors who are struggling to find out if they can pay their bills for something that they have no control over, even though they're paying for insurance. We have problems with donut hole gaps where their insurance covers so far, and if you are sick enough, you have to wait until it goes even farther before it picks up again. So you're paying out thousands of dollars for something you can't control. I have friends who have had cancer. I have friends who have MS, lupus, have fallen down and broken something vital like ankles, and that stops them from walking for the long term. I've had friends who had overcome illness that they did not have a choice, that they did not cause. My grandmother has survived cancer twice. She has to deal with being overweight. She is unable to walk without having some sort of help and stability. She can't drive. And when she goes to the doctor, she ends up with bills that she can't afford. She is on a fixed income. She makes less than $12,000 a year. And if she gets sick, she stays home. She has health coverage, but she stays home because she can't pay anything more than just being covered in case of an emergency. And that's unnecessary, and that's our elderly. Then you move over to our children. Our children have no choice in where their health care comes from. They can't get a job and get health insurance. They didn't make a mistake in their life and lose money or pick a poor job choice. They don't have a choice. And even recently, we have experienced where we are going to make it even more difficult for our children to be covered if they get sick. And children don't have a choice. And anybody out there who has kids in the school systems knows that every 2 or 3 weeks, your child will come home sick. My children just came home sick the other day, and I had to take them to the doctor. And without the fact that I can afford to take my kids just because they're sick, my kids wouldn't be in school today. We are looking at an epidemic of people who are just not being covered for something they can't control, for something that we all experience on a regular basis. We're talking people who have disabilities. We're talking about people who have general colds that get out of hand, and the next thing you know, they have pneumonia. This is something we can fix. This is something we can help. And if we don't take the time to figure out how to help everyone, all we're going to be doing is saying, well, I'm fine, and watching our neighbors suffer. We will be able to help those suffering from opioid addiction and drug epidemics. We are going to be able to help those who go out and work really hard to take care of our communities, be it police department, fire department, EMTs. These people put their lives at risk and they get hurt just as much as the rest of us. And why are we not taking the time to make sure they are cared for? It is time for us to make a difference. As a community, collective, we can make this difference. We work hard to feed the needy, so let's work hard to keep us all healthy. And then we can work hard together to fix everything else we suffer from. We can end suffering, but we can start it here by making sure everybody can be healthy to work together. So please listen to everything that we are all saying, because we can make a difference, and so can you. Thank you.
Hey, thank you for coming out. I'm Steve McBride. I'm representing I'm the Democratic nominee for Virginia's 8th House of Delegates district. And to quote a slightly more famous Democrat, it's the economy, stupid. If we've got people who are sick and taking off work because they can't see a doctor, then they're not contributing back to the economy. If we've got folks who have to declare bankruptcy because they can't afford their medical bills, then we're not contributing to the economy. With a single-payer system, Virginia can be at the forefront at caring not just for our people, but for our state economy as a whole. So I stand together with these fine people and those who signed the statement who couldn't make it today to say strongly, we need a single-payer system in Virginia. Thank you so much for coming out today.
I'll lower this. I'm Angela Lynn. I'm running for the House of Delegates in the 25th District. The most important reason that we need to start paying attention to our corporations that are funding our campaigns for our legislators is because this profit can be taken out of our healthcare system. The healthcare system should be something that everyone can afford. Bankruptcies right now, the highest amount of bankruptcies are being attributed to healthcare costs that people have had to had their income stripped. So when you have people who are taking a bankruptcy and a choice between getting the proper care because we've put profit before people, then I think that equation needs to change. Along with the idea that there are people who work in the healthcare industry that want to see their patients get the proper care, and they are standing up for this. This is something that they believe is the humane thing to do, but also they see where the profit is taken over the human rights. And so what we need to do as a people is to say to ourselves, is this money more important than the people who are working every day in Virginia and contributing to our society? And along with that, is it something that we can ignore any longer? And the answer is no. The corporate greed has taken away from us our own sensibilities of looking at who we're hurting and why we're hurting them. When we're at these doors and talking to these people who come to answer their door as a politician's never been there before, I hear them tell me, my biggest issue is I've had so much anxiety over healthcare that I'm not getting any sleep. I don't really know what I'm going to do tomorrow. I have a child who's already has a chronic illness that we've gone through bankruptcy. We need somebody to actually go to Richmond and do something that gives us some kind of hope that people are listening and caring and actually making sure that this doesn't happen again. So I feel very strongly about everything these politicians behind me have said, that this isn't about us being more powerful as a legislator. This is about us being more powerful because we were listening to the people. So thank you.
Hello, my name is Corey Johnson and I'm running for the House of Delegates in the 97th District. To everybody who is yelling at their TV screen right now or their computer screen or however you are finding this message, somebody is benefiting a lot from the current system. Somebody has a lot to gain by keeping our healthcare system exactly the way that it is, and that somebody is not you. And it's not Virginia's working families. Myself and the people behind me are here at great personal risk. We're willing to stand forward and potentially piss off both political parties to be able to stand up for working people of Virginia. As a firefighter and paramedic, I wish it wasn't true. I wish it never happened. But many, many times I would pick up somebody who had a life-threatening condition and would tell me, but wait a minute, but how am I going to pay for this? But I can't afford ambulance services. And I have had to plead with them, please, let me help you. Please let me help you. I didn't learn that in paramedic school. They didn't tell me in paramedic school that I would have to try to explain to my patients that their life is more important than filing bankruptcy. But unfortunately, my patients have had to make that decision to come with me in my ambulance and live another day, to live to file bankruptcy. That's not acceptable. That's not okay with me. And it has nothing to do with what party I'm running with. It has nothing to do with the opponent that I'm running against. This has to do with everybody in Virginia. So I ask all the voters, take a look at who's up here now and consider who they are and what they're fighting for, not the political party that they're with. Thank you.
I have some prepared remarks to conclude this. So as I said earlier, my name is Lee Carter. I'm the Democratic Party's nominee for the 50th District. I was driven to politics and to my support for single-payer health care through two first-hand experiences with our healthcare system, both caused by on-the-job injuries. The first was in 2009 while I was on active duty in Kuwait. I had the misfortune of having a 400-pound crate of radios dropped on my leg. The edge of the crate sliced my thigh open so deeply that I could see the muscle. I went to medical, I showed my ID card, and I was promptly treated. The entire focus was on healing, so that I could return to my normal work as quickly as possible. There was no hassle over billing, no pointless red tape to cut through, and most importantly, no out-of-pocket cost. The second was in the summer of 2015, several years after I left active duty. I was installing a lighting control panel, which, unbeknownst to me, an electrician had miswired. I received a 245-volt electric shock across my heart, and I blew my back out while pulling away from the panel. I cycled through a handful of workers' comp doctors and in-network doctors before finally having to pay out of pocket to see an orthopedist who was able to quickly diagnose and treat the cause of my back injury. In the meantime, I had been suffering and unable to work or even to walk for 3 months. Rather than focusing on healing, I had to figure out how to pay my medical bills and wrestle with my insurance company and my former employer to get the care I needed. Here in Virginia, there are an estimated 750,000 people without health insurance. Even the most generous estimates for Medicaid expansion predicted it would cover 400,000 people, leaving 350,000 still with no coverage whatsoever. On top of that, there are hundreds of thousands, if not millions more, who have health insurance but cannot afford to use it. A single-payer system that works with every healthcare provider in Virginia will benefit the overwhelming majority of Virginians. It will be better for providers who will no longer have to navigate the billing systems of multiple different insurers. It will benefit individuals who will no longer have to worry about whether or not a doctor is in network and whether or not they can afford their deductible. It will benefit employers, particularly small businesses, who will no longer need to navigate the complexities of healthcare enrollment or struggling to compete for employees against larger businesses that can afford better benefits packages. We've built extraordinary complexity into our civilian healthcare system that doesn't need to be there. Health insurance companies have never given a vaccination. They've never set a broken bone, and they've never sutured a wound. They take money from the consumer, keep a portion for themselves, and then pay healthcare providers as little as they can get away with. The people of Virginia can do better than that by doing it for ourselves, with a single-payer healthcare program which will be accountable to the people at the ballot box and will not be run to enrich a small handful of executives and investors. When a member of your family is sick or injured, their health should be the only consideration. That person should be able to go to the doctor and get the treatment they need. Our current health insurance system causes worse healthcare outcomes and drives costs up, not only for the families of the people who need treatment, but for everyone who pays into the health insurance system to cover the cost of that treatment. Let's take a look at the numbers. Virginia currently spends $62 billion every year on healthcare from all sources, public and private. That works out to around $7,700 per person per year, whether they have insurance or not. Meanwhile, other countries, Austria in particular, which has roughly the same population and GDP as Virginia, spend about $5,500 per person per year with their single-payer system. This is a cost reduction of nearly 29%. And estimates based on their costs, which are still far higher than nearly any other country other than our own, put the cost of a single-payer healthcare plan for all Virginians at $45 billion per year. Between Medicare and Medicaid, the Children's Health Insurance Program, TRICARE, the VA, we already spend $23 billion in public money on healthcare Virginia. I'm sure each candidate here has a different idea about where the other half will come from, and that's something that we'll work together on in Richmond. But it's important to note that Virginia employers currently pay far more than that towards their employees' healthcare costs. What's perhaps more challenging than finding the money is challenging the status quo. The healthcare industry contributes more to political campaigns in Virginia than any other. There is tremendous incentive for politicians to maintain the status quo because our current system is one that greatly benefits those industry donors. But maintaining the status quo carries with it a very real cost, both in terms of dollars wasted and families shattered. Approximately a third of Virginia's Democratic challengers have pledged to fight for single-payer health care in Virginia, and I encourage the remaining candidates to do so as well. Polls show that a majority of the American people are in favor of single-payer health care, and it is quickly becoming the mainstream of American politics because it's common sense, and we have almost a century of precedent that shows that it works. These are not uncharted waters. Dozens of other industrialized countries have shown for decades that this works. The first responsibility of the General Assembly is to the health and safety of Virginia's residents. The candidates who have signed on have pledged to do the hard work, to guarantee every Virginian the ability to see a doctor when he or she needs it, to protect the health and safety of everyone who calls Virginia home, regardless of what the federal government decides to do. It's simply too important to leave this decision up to Washington. Thank you.